Hey, what's going on, beautiful people? Hey, BRCA Strong community. It is your girl, Dr. Alexea, BRCA Strong Medical Director, triple board certified infectious disease physician, mom, speaker, author, cancer wellness coach, and stage 3 breast cancer survivor thriver. And I create healing pathways so that others can experience total health and cancer wellness, mind, body, and spirit. So I am on today as the medical director of BRCA Strong, and today we're going to be talking about decreasing our risk of operative infections when we're going for all of the different types of surgeries that we can have in the setting of cancer. Hey, Lauren. Hey, Lana. Hey, Dolce Vita. Hello. Thank you for everybody who's tuning in for the first time. And thank you for everybody who was on and we lost our sound and we're coming back, right? So I don't believe in accidents or coincidences, right? For me, it's just it didn't start the way it was supposed to start. And so we just got to start over. So for those of you who heard the first round of information, please do bear with me because I want whatever version of this presentation lands on the BRCA Strong page and lives there forever to have everything in it. Right? So we are all part of the breast cancer and ovarian cancer community, and we are here regardless of our genetic predisposition to either of those conditions, right? We are here because one or both of those cancers has touched us personally or touched somebody we love. And you all know that here at BRCA Strong, we provide pre-mastectomy care packages to women and people who are about to undergo surgery for breast cancer, whether it is a preventative surgery or whether it is a treatment or curative surgery. We support women who are going through these surgeries. And so in addition to just giving a pre-mastectomy care package to those who are able to receive and benefit from them, we definitely also wanted to make sure we provided some information about how we can what steps we can take, right? What we can do personally for ourselves that help decrease the risk of getting a surgical site infection or a post-operative infection. So when you think about infections, I think it's helpful to know some statistics, right? So what's the data on surgical site infections, or what is a surgical site infection, right? Surgical site infections are what we consider healthcare acquired infections. And usually it's an infection related directly to the site. My pleasure, Tracy. Related to the site of where you had the actual incision, so where you were actually cut. And that infection can occur anywhere within 30 days of a surgery. But for those of us who have like any sort of prosthetic material, so those of us with breast implants, tissue expanders, those of us who have undergone flap surgeries, a surgical site infection can occur up to 90 days out from when we've had the actual procedure. And in terms of, what we're doing versus what is the surgical team doing, right? The surgeon, knows how to maintain a sterile environment and sterile surgical field. They disinfect their hands by doing a surgical scrub. They wear hospital scrubs that they, put on when they arrive to the operating room area, right? They don't come in off the street and they don't operate in street clothes. They gown, they cover their hair, they cover their beards for those people who have facial hair, they cover their shoes. They do everything that they can to minimize the probability or chance that they're going to bring in some foreign bacteria into that sterile operating room, right? There's sterile procedure, there's new and sterilized equipment. Everything is handled in a sterile manner, including like your implants, right? So your implants, when they're put in, if you have an implant reconstruction like I have, those implants, like, they're only handled in a sterile fashion. They don't get laid on your skin or laid on your belly or just handled in any sort of random way. They have to be handled in a sterile fashion from the time they are taken out of their packaging to the time they go into your body. And your surgeon is taking such care to avoid contaminating that implant or contaminating the mesh or the sling that they might use to help with your reconstruction, or to avoid contaminating even the skin from your belly or your thighs or your buttocks or wherever the fat that they've taken out. They're use sterile technique and sterile procedure to avoid getting anything contaminated with bacteria, so that when they replace it, or when they close you up, or when they transfer skin and tissue and fat from one place to another, they're not causing an infection in the process. So because, surgery involves cutting of the skin, it's so critically important for us to make sure that we take care of the integrity of our skin and make sure that we decontaminate or decolonize our skin. So if when we think about our skin, remember, it's your first level of protection, right? It is your first barrier to infection. It's the largest organ in your body, but also in your immune system. And so we want to keep it clean. We want to keep it healthy. We want to maintain the integrity of it so that we don't have issues with, bacteria getting in, stitches or sutures holding, so that we don't have skin that's tearing or breaking down, etc. So, let's see, 14 karat gold. Let me complete this statement because chemo brain don't let me be great. And then I'll come back and answer that question. So, when I talk about the integrity of your skin, I'm talking about little simple things like just being well hydrated. So your skin is not dry, cracked, or chafed, which I always have dry hands. I put lotion on, so I'm not like having the dry cracks in my skin. But when your skin is really dry because you're dehydrated or because you haven't moisturized it or taken care of it, those little cracks in your skin are areas where bacteria can potentially get in. And if you're talking about a surgical site where the surgeon now has to go with the scalpel and cut, right? Imagine that skin is not healthy. Imagine it's not hydrated. Or it doesn't have the nutrients or blood supply that it needs to heal well. All of those things can increase your surgical risk. So, if you have some advance notice, your surgery isn't some emergent surgery that you're going in without any advance warning, like make sure you're eating well, make sure you're eating healthy foods, healthy fats, like the kinds of fats that are in fish like salmon and tuna, or the kinds of healthy fats and protein that are in things like avocado and almonds and eggs and other foods that are really good for your skin. Usually we're thinking about foods that have vitamin A, vitamin C, vitamin E, that are high protein foods, but not like super unhealthy fatty foods, because those things come with inflammation, and we don't want inflammation, right? We just want protein, we want good healthy calories, we want hydration, and we want sound nutrition so our body is prepared to heal. So that's like what we're ingesting, right? You want to eat high water content foods. So think about salads, think about tomatoes, think about melons, think about berries. Those are all great foods, cucumbers, that have high water content, so that you're getting both nutrition, vitamins, nutrients, and you're getting that hydration that you need. You do not want to get on the operating room table dehydrated like I did. It's not good for the skin. It's not good for your circulation and blood flow to the area that you're having the operation on. And it's just not good for the hemodynamics, right? And what I mean by that is like, what's your heart rate? What's your blood pressure? Are your kidneys and other organs getting perfused while your body is going through, the trauma, albeit a healing trauma, the trauma of surgery? You want to be in your best condition. So some of this talk is like how to get your body into its best condition before you have the surgery. So some of the things that we can do surface wise on the skin is like decontaminate or decolonize the skin. So we mentioned before we got cut off using surgical scrub. So Hibiclens or chlorhexidine wash is what surgeons use in order to prep their hands before they go into the operating room table. Like they literally wash up to their elbows for 2 minutes to get as much bacteria off of their skin as they can. And we can do the same before we go into a surgery. A lot of times if you are going to a center where they're kind of mindful of this, they may give you 2 surgical scrubbies and say, wash from your neck to your toes and this stuff the night before your surgery and the morning of. But for me, I did it a week before my surgeries to really just kind of decontaminate or decolonize my skin. And how you go about it is important, right? So you do your normal bathing, you rinse your skin clean, and then you get as much of your skin cleansed with the surgical scrub, HipaCleanse or chlorhexidine. And then you just let it sit for 2 to 5 minutes, and then you rinse it clean. And the reason you want to rinse it clean is because this stuff is very drying. So it will make your skin very dry and chafe. So moisturize your skin after you use this stuff, and moisturize it with a nice, clean, healthy product, right? So use like a shea butter or coconut oil or, some other natural moisturizer, or a moisturizer that is like hypoallergenic, not super loaded with chemicals and parabens and other non-healthy things. But do not put any moisturizer on your skin the day of your surgery. We want just clean, dry skin the day of the surgery. So leading up to our surgery, we just want to make sure we have well taken care of skin so that we can minimize the risk of surgical site infections. So those infections where the skin has been cut, right? So for us, we're talking breast area or lower abdominal skin or pelvic skin. And the risk to developing a surgical site infection, even when we do everything right and even when we do everything perfect, is still 2 to 5%. So 1 in 24 patients who undergo inpatient surgery in the US is going to develop a postoperative infection, even when we do everything perfect. But, we want to give ourselves the best fighting chance, right? So that's why we're having this conversation. So if you have an existing infection, right, treat that infection. And that's part of why you have to get blood work and give urine and all of that. Because for those of us who are getting implant reconstruction, those of us who are getting flaps, those of us who are getting mesh, flat transfers, all of these things, right? If you have an active infection in your throat, in your lungs, in your bladder or your urinary tract, those bacteria can get out, get into the bloodstream, and potentially get to your surgical site. So make sure you let your doctor know if you developed any infection before your surgery, even if it's something as simple as a common cold. These kinds of things can wreak havoc on your body in the surgical setting or in the setting of anesthesia. So I have canceled people's big, major, important surgeries because they got a cold from their kid. So especially in the day and age of COVID, stay isolated from people, take time off from work, do what you can to minimize the risk of any infection. And if you have any signs or symptoms of infection leading up to your surgery, go see your primary care doctor or your primary care provider, whoever that may be. And make sure you get checked out and treated for any infections that you might already have, because you don't want your prosthetic material to get contaminated with any bacteria from somewhere outside of the surgical site. So let me go back to this question. So for 14 karat gold says, what is recommended? Do implants at the time of cancer removal or separate surgery? So we can't make a hard recommendation about this 14 karat gold because there's a lot of things that go into that decision making. So it would be fantastic if everybody could just go direct to implant. But things that determine whether or not your surgeon can go direct to implant is like how big your tumor was, what was your stage of diagnosis, if you're going to need radiation. Chemo is, I think, kind of less of an issue, but if you're going to need radiation, you often can't go direct to implant. If your tumor invaded the skin and they had to remove a lot of skin and you need to undergo tissue expansion, that's also something that plays a role in whether or not your procedure is going to be what we call staged. So I had to have a staged procedure. So I had a very large tumor. It was very close to my skin, so they had to take away a lot of my skin. And so I was like concave, right, when they finished my mastectomy. So I had to have tissue expansion because I didn't have any skin really to put an implant into. And I also had to have radiation. So direct to implant wasn't an option for me. But I definitely asked. I was like, could I skip a step? So I wasn't able to. And then Clara Ramsey says, I have my exchange surgery coming up to switch from tissue expanders to implants. Thanks for the information. Oh, you are absolutely welcome. You're so very welcome. And then Katney says her reconstruction is finally here, November 24th. Whoop, whoop. So this is a super timely conversation. And this is a conversation that people need to hear over and over and over again, because somebody's always finding out about a gene mutation and trying to previve breast cancer or other cancers. Somebody is always getting diagnosed. We know that women are diagnosed with, or people are diagnosed with breast cancer every 2 minutes. We have stage reconstructions. Lauren's going for her deep flap on Friday. So whoop, whoop, you got enough time, Lauren, to put some of this stuff into action as well. So take care of the skin, right? And then manage, other infections that you might have going on. And then nutrition, right? I briefly touched on nutrition, but the reason I'm mentioning nutrition, and even if you're 4 days out from your surgery, you can make good food choices. You could be taking in high protein, healthy fats, drinking all the wonderful things like teas and antioxidant rich beverages, and eating all the things that are helpful, because your nutrition is so critically important to decreasing your infection risk. So people who are malnourished, right? People who, kind of live off of the SAD diet, the standard American diet, which is, too high in carbs, too high in fats, too much fast food, and too much nutritionally deplete food, you have a 6-fold risk of postoperative infection when you're malnourished. 6-fold. So the minute you know that you're having a surgery, or if you just know you have a risk, eat the same way you would if you were finding out you had a genetic predisposition for cancer, or finding out that you had some quote unquote, I'm going to say precancerous, even though that's not the language we use. Even if you don't have a genetic predisposition, but you know you have a predisposition for breast cancer because you had LCIS or DCIS, or because it runs in your family, and you're taking those steps to try to decrease your risk for cancer, right? You're eating more plants, you're eating more fiber, you're cutting back on carbs, you're cutting back on animal fats or dairy or whatever. If that's your thing, and if that's how you choose to proceed, because we know there's not one single thing that's going to stave off cancer, but there's a lot of things that we can do to decrease our risk, right? Whether we're talking about primary risk or recurrence risk, like do all of those things. So, I don't believe that there is one single diet that is right for those of us who find ourselves facing cancer one way or the other. But there are dietary changes you can make. So increase your plant-based proteins, increase your plant-based fat. So go for things like olives, cook with olive oil, do your avocados, right? And then if they're like, in terms of what has been studied, and is there a diet that has been associated with decreased cancer risk, and I'm going to say decreased infection risk as well, it's a plant-based diet and a Mediterranean diet, right? And what does the Mediterranean diet have in it? Lots of plant fats, but also lots of like omega-3, lots of healthy fats. So things like fatty fishes, right? So salmon, tuna, sardines, things like that. So look into those diets, or just look into adding more plants to your diet, because if you're improving your overall health and you're improving your gut health, which is what these diets do for you, you're improving your immune system. Much of your immune system actually lives in your gut. And so if your gut is healthy, your immune system is gonna be healthy. Okay. So, my ring got caught in my hair. Excuse me. So again, malnutrition increases your risk of surgical site infection 6-fold. All right. And so consider a plant-based diet. And really that just means making plants the star of your plate. All right, I'm going to hop off of that little soapbox. Also, do prebiotic foods. and introduce probiotics. Again, we're talking about gut health. So what do I mean by prebiotic foods? Things that are high in fiber. So we talked about plants, but also fermented foods. So things like kefir and kimchi and yogurt. Those are things that are prebiotic. You could also do things like kombuchas. You could do high vitamin C containing foods to increase your immune health and immune function. So think about like your citrus fruits and other fresh fruits and dark leafy green vegetables, really high vitamin C content. And all of this is good to help boost our immune system, right? I already mentioned healthy fats as well. So foods that are high in omega-3 fatty acids, foods that are anti-inflammatory. So when I think about anti-inflammatory foods, I'm thinking about like my berries, right? Foods that are rich in antioxidants. I'm thinking about ginger. I'm thinking about, I'm thinking about, turmeric. I'm thinking about just so many foods, so many things come to mind. And the beautiful thing about this kind of lifestyle is it decreases your overall risk for things like diabetes, which is an immunocompromising state. And it's a state where people are at increased risk for infection. So if you have other chronic medical conditions like diabetes, you want to make sure you're taking steps and measures to get your blood sugar under control, right? So you want to decrease your simple carbohydrate intake leading into your surgery. And that's really diabetic or not, because high blood sugars are associated with poor wound healing. And if your wound isn't healing and that skin isn't closing up, that also increases the risk of surgical site infections. So definitely cut the sugar. Smoking. So if you are a smoker, smoking cigarettes increases your blood pressure and it causes your blood vessels to constrict or clamp down, right? And our blood supply is so important. Our circulation is so important because it delivers oxygen or oxygenated blood to the site of the infection, which we need for tissue survival and healing. It delivers the necessary nutrients to the surgical site, which we need for healing. So if you smoke cigarettes, quit smoking. Not only does that decrease the risk of surgical site infections, it also decreases the risk of complications of surgery like pneumonia or lung infections. It decreases the risk of things like blood clots that can be associated with not just surgeries, but also we have an increased risk of blood clots because we've had cancer. So smoking compounds that risk, and it increases the risk that you will have complications of your wound, including poor healing or what we call wound dehiscence. So wounds can open back up. So that's definitely a big deal and something to keep in mind. Hey, Yahira. So 14 Karat Gold says, any dietary considerations for cancer plus thyroid conditions? So yeah, I've heard that too, that cruciferous vegetables, so like broccoli and cabbage and cauliflower, may not be the best for people with thyroid conditions. But the beautiful thing about just what the planet has to give us in terms of fruits and vegetables is there's such a wide variety of things that I think it's important to not feel like you have to get one from every, island in the Caribbean, or you don't have to get, one from every food group. Like, eat what you love. And there's things like, that I never get tired of, that I know I can never eat too much of, like kale or spinach, right? Those are just my loves. I've been eating kale and cooking it since I was 9 years old, before the rest of the world figured it's not just a garnish, but that you can eat it and it's a superfood, right? So dietary wise, I think as long as you're getting a variety of fresh vegetables in, or a variety of frozen vegetables, if you don't have access to fresh vegetables, And then the other thing I would say is just like know your dirty dozen and know your clean 15, right? So the dirty dozen are the fruits and vegetables that you should try to buy organic if you can. And then the clean 15 are the fruits and vegetables that you do not have to waste the money buying as organic. So I think, having a list like that, 14 karat gold, and then knowing what foods work and don't work for you or anybody else based on other medical conditions, allergies, certain foods you can't eat because, you're on a blood thinner or because it may interfere with other medications you're taking, right? So all of this information is sort of large and generalized and will apply or be applicable to most of us. But, we kind of have to shift as we need to based on our own personal needs, right? So there's that, right? And then, I miss one important thing when I was talking about the skin, right? Taking care of the skin. Let me go back to that for a minute. So shaving, okay? And waxing. The day before your surgery is not the time to go shaving everything. Your surgeon does not care was groomed, was not groomed. Is it patchy? Is there new growth? Is there stubble? So don't go shaving and don't go waxing, the day before your surgery or the week of your surgery, because when you do those things, right, you can cause like little micro traumas to the skin that allow bacteria to get in and set up shop and increase your risk of surgical site infection. So like if you're about to have maybe a laparoscopic surgery to take out your ovaries and tubes because you're surviving or previving ovarian cancer, don't go shaving your little belly hairs or your pubes. Your surgeon does not care, but you can, disrupt the integrity of the skin before your procedure. So don't do that. Preoperative hair removal actually increases the risk of surgical site infections. So don't do that. All right. In terms of just taking care of your overall health and well-being, leave them legs alone, Yahira. Leave them alone. Don't do it. You're too close. Just let it be. Your surgeons do not care. They don't care. They just want you to be safe and healthy, and they want you on that operating table in your best condition. All right. So exercise, moving your body, right? Some of us get like weeks or months notice before our surgery. And some of us, like I mentioned, we're going in emergently. We got 2 days, 2 weeks notice. But even for 2 days or 2 weeks is enough time to decide I'm going to take 2 brisk walks for 30 minutes a day leading up to my surgery, because exercising helps expand your lungs. It helps you burn sugar and excess calories. It keeps your body limber. It helps improve your circulation, improves your mood. It might help you sleep better leading up to your surgery. And Lord knows you need to get rest leading up to your surgery. But exercise improves immunity and it decreases inflammation in the body. And this is important for our immune health and for our ability to decrease our risk of infection. The other thing that exercise does, and it doesn't have to be kickboxing. It doesn't have to be CrossFit. It could just be, XOXO. No Brazilian wax before your deep flap. Don't do it. No, don't do that. Don't do that. Don't do that. I'm sure your surgery team might appreciate the beautiful grooming, but don't do that before your procedure. No, ma'am. Don't do that. Cancel that. And when you recover, when you're on the other side of that deep flap and you feeling all good and you need the boost to your mood and your well-being and your self-confidence after you healed and you have new surgical scars and you're getting adjusted to life in your new body, then you go for the Brazilian, for the extra, whatevers, but don't do it before your surgery. Please don't. So the last thing that, the aerobic exercise, the jogging, the brisk walking, the HIIT workout that does is it actually helps regenerate some of the cells of your immune system. So that's why we tell people to exercise as part of their survival, because your immune system plays a huge role in fighting cancer cells. So a nice, cheap, free, easy, non-medicinal way to improve your immune function is just to do aerobic exercises and walk. Next thing to deal with, because it has the opposite impact on your immune function, the next thing to deal with is stress, right? High levels of stress, anxiety, etc., can suppress our immune system. That's why people who go through stressful events can end up with things like shingles or other infections, because their immune system gets stress and it gets suppressed, and then they become vulnerable or more susceptible to infections they wouldn't otherwise get. So minimize your stress. So ways we can minimize our stress, right? Go back to 2 minutes ago. Exercise, take a walk, take a nice run, journal, color, go get a massage, go see your therapist, do some yoga, do some deep breathing exercises, do some guided meditation, right? These are all things that you can start to employ. Absolutely, 14 karat gold. Definitely easier said than done. When I first got diagnosed with my cancer and I was going through my cancer treatment, I kept like racing ahead to the finish, and it was stressing me out because I was thinking of all the possible complications of the chemo, possible complications of my surgery, possible complications of radiation, and I hadn't even done anything yet. So I started doing guided meditation. So go on YouTube, find a guided meditation, go on Calm or Headspace or one of those apps that walks you through a guided meditation, and start with small pieces. Don't say I'm going to meditate and then try to meditate for 20 minutes. You will never get through the process. Start with 2 minutes, 3 minutes, 5 minutes of guided meditation and gradually increase it as you get better at it, because meditation and mindfulness is not an easy practice, but once you get the hang of it, it's such a powerful tool to manage stress and anxiety. When you manage your stress and anxiety, you actually improve your immune function, because those things create inflammation, they destroy and prematurely age your DNA, and they suppress your immune function. And that's not good. We don't want that. So we got to deal with stress and burnout. For journaling, you could either use a blank journal or you could use a guided journal if you don't know what the hell to write. Like, journaling for me was huge when I was going through cancer. And so it actually inspired me to write a guided journal. It's a gratitude journal. So it gives you a daily writing prompt, and then it gives you, or not even a writing prompt. Like, my journal isn't today you should write about. It's just a quote, a phrase, something that got me through, something that I know that got other cancer survivors through. And it may prompt you to write something based on that quote or some feeling that quote might bring out in you. But it's a way to get those feelings from out of your mind, out of your body, out of your spirit, get it off your chest. And when you release that through the process of journaling, you relieve a lot of stress, you relieve a lot of anxiety, and you relieve a lot of the physical tension that you hold in your body that doesn't serve you and that fights the immune system. So it's easy to say journal, but sometimes people don't know what the hell to write. So I wrote a guided journal, and there's plenty of great guided journals out there to give you prompts. And then, making sure we stay healthy. I already mentioned, right? In these COVID streets, right, we're all day fighting infections, right? So if your surgery is during cough, cold, flu season, go get your flu shot. If you're due for a pneumonia shot or a tetanus booster, get those vaccines that you're supposed to have. Make sure you're current if you're a vaccinating person. Stay away from sick people. And that might include staying away from your school-age children or your toddler or, 4-year-old that's in preschool, never been in school, never been exposed to germs, and is going to bring home everything they breathe in. Maybe in the days or weeks leading up to your surgery, you might pull them out of that care or get in-home child care to minimize your risk for infection. Maybe you don't work for 2 weeks before your surgery and just prepare by doing all of these other things and get your home ready for surgery, instead of working like I did up until literally hours before my surgery. Don't do that, because when you're exhausted, when you're dehydrated, when you aren't well fed and well nourished, you're setting yourself up for trouble. So avoid COVID, avoid other germs, avoid sick people so that you can minimize your risk of getting other infections. And then you can consider supplements that help support and improve your immune system. So some of the supplements that you might consider taking would include things like vitamin C, vitamin D, zinc, because those are the building blocks that are necessary for healthy immune function. Some people use other things like elderberry and echinacea, or just a regular multivitamin. But word to the wise, right? You need to know what's in these things, and you need to inform your surgeon that you're taking them, because there are things like vitamin E and fish oils and some of the other ingredients that might be in a multivitamin that we want you to stop taking 1 week prior to your surgery. So when your surgical team asks you what you're taking, tell them everything, including supplements, over-the-counter meds, those things you take on occasion, like Tylenol and Motrin, and ask, what time frame do I need to stop taking these things before my surgery? Because while they have benefits, they also have risk and side effects associated with them. So these are things we generally recommend you stop taking 1 week before your surgery. Vitamin E, fish oils, Motrin, ibuprofen, aspirin, NSAIDs, things like that. So make sure you run it by your surgeon. But again, some of the nutritional supplements you might take to support your immune system include things like vitamin C, vitamin D, zinc, echinacea, elderberry, etc. Listen, one of my most favorite immune boosting tips is sex. Okay. Sex is, if you're having good, healthy sex, right? Either in your relationship, whatever your relationship looks like, and you're not at risk for getting a sexually transmitted infection, because we don't want that leading up to our surgery. But sex is important for building your immune system, right? It improves your mood. It improves your emotional connection to the person that you love and share an intimate partnership with. It burns calories. It releases inflammation. It helps decrease stress. It actually even alleviates nasal congestion, believe it or not. It improves sleep, and it improves your immune system function. So if you are in I shouldn't even limit sex to being in a relationship, because that's not a qualifier for sex. And I'm sorry, Tracy, I know this is a nonprofit, but it's part of the conversation. So don't feel like you have to stop having sex because you are having a surgery. If your sex is not considered high risk and doesn't increase, that's right, Yahira. If it doesn't increase your risk for a sexually transmitted infection, right? Because people are all having sex under different circumstances. So if there's no increased risk of infection, don't get pregnant though, okay? Don't get pregnant if you can, because I realize that pregnancy is a risk for some of us in the community and not a risk for others of us in the community, right? But a pregnancy would preclude your surgery. And so don't get pregnant, but understand that there are some wonderful health benefits to having sex. So burning calories, relieving stress, improving your sleep, right? That big O will give you some really good rest. And then improving your immune function, right? So it's not off the table as long as you don't get pregnant when you wasn't supposed to, right? Imagine getting ready to go in for your deep flap and you find out you're pregnant. And it happens. So I know we get offended and we feel attacked when we're in chemo pause, or when we are in or ovarian or hormone suppression, or we're going to get these ovaries out. Like, why are you worried if I'm pregnant? It happens. People go in for these procedures, and these procedures have to be canceled because they got pregnant. And I shared a panel with a breast cancer survivor who was in chemo pause, had not been menstruating, was told that she is infertile, can't get pregnant, and basically was experiencing pregnancy symptoms and thought she was having like a breast cancer recurrence, and she just had an unplanned pregnancy. So don't get pregnant. It happens. So that's it. I'm going to just quickly go down the list of things that we talked about in terms of ways that we can decrease our risk for infection for those of us who are going into procedures. We got Yahira on here, who is having surgery Wednesday. We got Lauren on here from Type of Guide to Cancer, who is going in for surgery on Friday. We got some implant exchanges happening. And again, every 2 minutes, somebody is diagnosed with breast cancer, and often some sort of surgery is part of the treatment. Same is true for ovarian cancer, right? Often some type of surgery is part of our treatment. And so we want to make sure we are in our best condition to avoid a surgical site infection or an infection that can occur after surgery. So get your skin's integrity together, right? Hydrate your body, eat nutritionally rich foods, and take care of your skin's integrity by moisturizing it. Use that surgical scrub in the days leading up to your surgery, the night before and the morning of your surgery, but don't moisturize the skin the day of your surgery. No lotions, no deodorants, none of that stuff, right? Exercise, right? Exercise, move that body. Make sure you are minimizing stress. Make sure you are eating foods or taking supplements that support your immune health. If you smoke cigarettes, make sure you stop smoking cigarettes so that you decrease your risk of poor wound healing and surgical site infections, as well as decrease your risk of pneumonias, which we can see postoperatively, and decrease the risk of things like blood clots that can complicate surgeries. And just make sure you're putting your best foot forward when you climb on that operating room table, right? Make sure you go in well rested, well hydrated, free from stress, free from outside stress, right? Because knowing you have to have a surgery and knowing that you have to, have an intervention, you have to heal, that there's going to be pain that you're anticipating. Make sure you have a plan to manage those kinds of stresses. Stay away from sick people. Don't get COVID. Don't get the flu. Don't get your kids cold if you can. And, just do your best. Be in your best condition, your best shape that you can get yourself in whatever time you have, from the time you find out that you need surgery until the time that the surgery actually happens, because we have the ability to control what we can control and release whatever it is you can't control, right? Manage your stress, meditate, journal, talk about your fears, write about your fears, address your fears and your concerns with your surgical team and your medical team. And I wish you good luck for any procedure that you're having. So before I sign out of this live, I have to say, although I am a doctor, I don't just play one on IG. I am not your doctor. And so any information that I give is just that. It is information, right? There will be things that apply or do not apply based on your own personal health, based on your own personal preferences, based on your medical history, your surgical history, your surgeon's preferences, right? And so any information that has been provided, it is just that. It is just information. But knowledge is power, right? So be empowered, be prepared to advocate for yourself. And I wish you the absolute best in any procedure or any treatment that you find yourself facing in as it relates to a diagnosis or predisposition to breast and ovarian cancer. All right. So you guys know who I am. And if you don't, I'm Dr. Alexea, triple board certified infectious disease physician, mom, speaker, author, cancer wellness coach, and breast cancer survivor thriver. And I create healing pathways for total health and wellness, mind, body, and spirit. I'm before you today as the medical director of BRCA Strong, where we help to educate, advocate for, and supply pre-mastectomy care packages for women facing mastectomy or other breast cancer surgeries, regardless of your genetic predisposition. We are here for you. Make sure you connect with us. Make sure you follow us. Make sure you share our pages with those that are in the breast and ovarian cancer community. And we can't wait to engage with you again soon. I'm out, y'all. Have a fantastic night. And thank you so much for your time and attention and for joining me on this live. Bye.